Lumbar spinal stenosis, a lot of patients will ask me what that is. And stenosis means tightness is what it really means. And when you say you have stenosis, it means something in your spine is tight. And there's all these descriptive terms that the radiologist can use to describe where they're seeing the tightness. And me as a surgeon, I use terms to describe where the tightness is so that I can decide where I'm going to inject or where I'm going to do a surgery. But the bottom line is, for the layman or the patient, the key is stenosis means tightness. And when you have tightness in your spine, it usually means that there is a nerve that's getting compressed. And when that nerve gets compressed, that pain or numbness or fatiguing or weakness or irritation or burning travels down that path of the nerve. And so you can have a very reproducible exam or complaints about where your symptoms are relative to where the tightness is in your lumbar spine. And once we kind of make that diagnosis, both with the patient telling me where the symptoms are, or on my exam where I see the weaknesses or the numbness, and then looking at the MRI and seeing that the tightness kind of correlates with the things that we're talking about in the room, then we can come up with a treatment plan. And the treatment plan very much depends on how tight it is, where the tightness is. And usually, if we've tried the physical therapy and some medication and activity modification and time, usually the first intervention that I use in my clinic is some type of injection in the low back. And again, those injections, I kind of pick where to put those based on where the symptoms are and where I see the tightness or the stenosis. And those are usually in a steroid injection. Now, if we do those and that doesn't work, or doesn't work to the duration or the amount of relief that I and the patient both want, then we talk about doing a surgery to go in there and take the pressure off. And the surgeries kind of come in two different varieties. The first one is a decompression, which just means we go in there and take the tightness off. We do something to relieve the pressure. And then the second one is a fusion. And so oftentimes we have to use a fusion if there's some instability, or if the spine is loose or in a bad position. I'll have to take the pressure off, but then put the spine in a good position and then fuse it there with some screws. So stenosis means tightness, and we can get rid of the tightness by doing a decompression, and then sometimes we have to use screws to hold the spine in a good position, and we call that a fusion.